As we all continue to adapt to pandemic life and get into new routines, it's very important that we do not let our guards down. And that's especially true when it comes to our heart health. So we're joined today by Dr. Mayank Mittal. He is a Beacon Medical Group cardiologist. We're going to talk about cardiac care during the pandemic, doctor. So if I was your heart patient, what would you want me to know about cardiac care during the pandemic?
I think first message I'll give you is we have got your heart at Beacon Cardiovascular Care. We're watching you and we don't want you to be any more scared than you have to be. Having said that, I think COVID has affected all of us in some way or the other. And there are symptoms of chest pain and shortness of breath that can be vague, but can affect COVID patients, whether the virus is affecting your heart or if it's affecting your lung. And it can be very difficult, not only for the patients and their family members, but even for physicians to differentiate what's causing the problems. For some, the disease is mild and asymptomatic even, and they can be discharged without any short or long-term effects on their heart. For others, they are hospitalized, and some are very, very sick to the point that they may even require breathing tubes. And those are the ones where the question comes to mind, are they going to make it? If they're going to make it through this illness, what will be the short or long-term effect? And I think there are many things that we really don't understand or know about this virus. We're just beginning to understand its effect on your health right now. So the questions whether this virus would have long-term implications of heart health, I think we're understanding as the time is passing by, and we'll probably know a lot more about it. There are certain things that are already in light. There is a condition called myocarditis, which is basically direct infection of the heart by the virus. And it is not something new. Virus has been affecting heart in the past too. It's just because of the COVID, this thing has come to a limelight. It tends to typically affect young people, and we're thinking of doing a special segment for that, for our athletes at Notre Dame and South Bend Cubs, and we'll talk more about that at that time. For our second group of patients, which are our elderly patients, I think it affects them in something called stress cardiomyopathy, where if you think about it, when you are really stressed or you are ill, your heart is supposed to meet your body's demand by increasing its supply of oxygen and blood. And in some cases, instead of rising up to the occasion, it almost kind of just gives up. And that's called stress cardiomyopathy. You get transient or temporary weakness of the heart. It can be severe, it can be life-threatening, but the good news is if you make through the acute phase, generally there is no residual defect in about 3 months or so. Most heart tends to recover very well. I would say if you are experiencing any symptoms, please do not delay your care for concerns of COVID. I know there is a lot of anxiety of coming to the hospital right now or not exposing yourselves to the doctors. There are many ways we can help you in person or through other mechanisms, but one of my biggest concerns for my heart patients is that if they don't decide to come to the hospital, they can have permanent damage. And by the time they present, it may be too late. And we don't want you to be in that situation. So if you are feeling fine, I'm so happy for you. We can do a lot of other things. But if you're not feeling fine, please reach out to your physicians to get checked.
How have we tried to help families who, because of visitor restrictions, have not been able to visit their loved ones in the hospital?
I think that is such a timely question, and I'm so grateful you asked that question because of all the patients that I've taken care of since the COVID began in March of this year. I think that's how I've personally been affected the most. This is where being empathetic comes to the limelight as a physician. We don't only have obligations of giving medicines and doing procedures on the patients we take care for. For every patient we take care of, we have loved ones that are relying on that patient, that are looking for that loved one to come home in good health. And a perfect example that comes to my mind is there was this grandmother and she was 85 and she came in with a massive heart attack. We did everything we could and we put stents in her heart. And when I came on service, she was not doing well on Saturday morning. Over the next 2 days, I was in touch with the family very closely, must have called them 8 or 10 times. The son was not far off. He was in Chicago, but because of COVID, it's like so close, but so far. And I could hear the pain in the voice. And I thought the least I could do for this family is at least keep him informed. And when the time came and when she was not making a good progress, it was just a little bit easier. I think it still was very tough, but I think it was just a little bit easier for the family knowing that there is a doctor who's taking care of them, not just the patient, not just the disease, but taking care of them as a family, and was keeping them well informed as things were moving along, even if it was moving in the wrong direction. But if we call them all of a sudden, or we don't call them, I think we are doing a disservice to our patients. And I think this is where being a part of Beacon Medical Group and Beacon Healthcare has been so important, because we all take a lot of pride in not only helping our patients, but their families too.
Oh, that had to mean so much to that son, I'm sure. While we've made changes to keep our patients safe and make them feel confident in their care here when they visit the hospital, not every visit has to be in person. Can you elaborate about that?
Yes, I think Beacon has been at the forefront of providing the care and adapting to the virus right from the beginning. We have stayed up to date with the guidelines. There are several guidelines from ACC, from American Heart Association, from our cath lab guidance. And we have made some structural changes, not just in every bed in the hospital, making them negative pressure rooms, but even in our cath lab. We have a dedicated cath lab, which is designed to take care of the patients should they come in with COVID and heart attack, or they're having a heart attack and maybe we could not rule out COVID before we bring them, to reduce the exposure to them and our staff. And I'm really proud of being a part of a team like that. The other things we are doing is we are also rethinking as how can we safely deliver care, not just in these last 6 months, but I think COVID has made us realize that we need to reinvent how we deliver care to folks and reduce the risk of giving them something that they were not having when they came to the hospital, i.e. COVID. And in that sense, I think Beacon has been really very aggressive about installing technology. We are doing a lot of telemedicine visits. We're doing a lot of phone visits. And specifically, when I personally see my patients, especially if they're senior patients and they are stable from their heart standpoint, I ask myself a question: do I really need to examine them personally? Do I need to listen to their heart, or do an EKG, or check something that I can't do on the phone? If the answer is yes, I would see them to make sure they get the best of the care. But in many cases, if they're stable, I could either delay their appointment so they don't have to come to the hospital or healthcare setting in the fall, when it will be so much more critical not to get exposed to infections, because it'll be very difficult for us to differentiate early on between flu and COVID. Uh, and then if I can check them online, then I'm available, and many of my colleagues are available, and Beacon has a very nice app that you can use where we could do a visit on the phone. And if it turns out that on the phone, after seeing you or after listening to your complaints, we need to see you in person, we are here. We'll see you promptly. And so I think in that sense, we're really proud on delivering this care through multiple mechanisms. And what COVID has done for everybody is just made us rethink how can we do things differently. And at Beacon, we take a lot of pride in doing that.
Doctor, thanks for joining us today and for your perspective, and we'll be looking forward to talking to you again very soon.
Thank you. Stay healthy and stay safe.